kasih atas kehadirannya di FMB 9.
Dan kita akan membahasnya di
dalam Forum Merdeka Barat 9.
Di Forum Merdeka Barat 9.
informasi akurat,
Data valid,
dan narasumber terpercaya.
Komunikasi pemerintah dan komunikasi negara telah berubah sejalan dengan perubahan era. Perubahan era dari era sebelumnya ke era reformasi, kita mengubah bentuk arah komunikasi dari komunikasi sentralistik ke komunikasi decentralized. Diberikan komunikasi ke sektor-sektor, di mana Kominfo perannya menindaklanjuti dan mengorkestrasi serta menyiapkan ruang desentralisasi komunikasi publik.
Forum Merdeka Barat 9 atau FMB 9 adalah forum dialog yang menghadirkan perwakilan pemerintah, lembaga hingga profesional di bidangnya dalam mengupas tuntas isu-isu kebijakan dan program pemerintah. Forum ini juga mengklarifikasi berbagai informasi sehingga masyarakat dan media mendapatkan informasi cepat, akurat, dari narasumber terpercaya.
Kominfo dan media adalah mitra yang erat. Dengan adanya metamorfosis digitalisasi media dalam mencari informasi, FMB 9 juga menghadirkan diskusi hingga video edukasi yang semakin mudah diakses dalam berbagai platform.
topiknya adalah
Disiarkan dari Bali International Convention Center di tengah gelaran presidensi G20 Indonesia, saya Ruli Kurniawan kembali menyapa Anda di Forum Merdeka Barat 9. Pandemi COVID-19 telah memberikan pengalaman bagi komunitas kesehatan global dalam mengantisipasi pandemi di masa depan. Dalam KTT G20, perkembangan dan strategi untuk memperkuat arsitektur kesehatan global menjadi acuan untuk keluar dari krisis besar dunia, bertahan dan pulih bersama. Recover together, recover stronger. Para Menteri Kesehatan G20 berkomitmen mengambil langkah guna mendorong dan memperkuat sistem kesehatan global, serta menyepakati 6 aksi kunci, yakni komitmen untuk memberikan dana perantara keuangan sebesar 1,4 miliar dolar Amerika dalam rangka kesiapsiagaan pandemi ke depan. Kemudian memperkuat mekanisme Access to COVID-19 Tools Accelerator Initiative. Berikutnya membuka jalan untuk penguatan surveillance genomik. Aksi kunci keempat adalah sertifikat perjalanan dalam bentuk digital yang berisikan informasi terkait vaksin dan hasil tes yang dapat dikembangkan pemanfaatannya lebih luas lagi. Aksi kunci kelima adalah analisa kesenjangan dan pemetaan kondisi saat ini. Dan terakhir, aksi kunci keenam, capaian nyata dari pertemuan set event dengan call for action, peningkatan pembiayaan untuk penanggulangan tuberkulosis, komitmen untuk mengimplementasikan inisiatif One Health, serta meningkatkan kapasitas deteksi dan respon resistensi antimikroba. Ini merupakan pencapaian besar dari presidensi G20 Indonesia yang nyata. Untuk membahasnya secara komprehensif, Forum Merdeka Barat 9 kali ini mengulas diskusi dengan tema Komitmen G20 Membangun Arsitektur Kesehatan Global. Bersama Senior Advisor to Director General WHO, Bruce Aylward, dan Maximo Terrero, Chief Economist FAO. Sebelumnya kita simak pernyataan Presiden Republik Indonesia Joko Widodo terkait penguatan arsitektur kesehatan global.
Perihal pembiayaan dibutuhkan sebesar 31,1 miliar dolar Amerika Serikat setiap tahunnya untuk membiayai sistem pencegahan, persiapan, dan respon terhadap pandemi di masa yang akan datang. Ini hasil studi yang dilakukan Bank Dunia dan Organisasi Kesehatan Dunia awal tahun ini. Untuk itu, G20 telah sepakat untuk membentuk dana pandemi bagi kepentingan pencegahan, persiapan, dan respon terhadap pandemi. Saya menyampaikan terima kasih kepada para donor dari negara-negara anggota G20 dan non-G20, serta dari lembaga-lembaga filantropi yang telah memberikan kontribusi. Namun, dana yang terkumpul masih belum mencukupi. Saya mengharapkan dukungan yang lebih besar lagi untuk dana pandemi ini.
Sebagai perspektif sebelum memulai dialog kita hari ini, kita saksikan terlebih dahulu informasi berikut.
Para pemimpin negara-negara G20 membahas upaya bersama untuk keluar dari krisis kesehatan dan krisis ekonomi akibat pandemi COVID-19. Salah satu upaya yang dilakukan adalah strategi vaksinasi global seperti yang ditetapkan Organisasi Kesehatan Dunia atau WHO. Terkait ketersediaan dana dalam menangani pandemi, para pemimpin G20 juga menggarisbawahi kerjasama yang erat antara Menteri Keuangan dan Menteri Kesehatan, serta organisasi internasional seperti WHO, Bank Dunia, Dana Moneter Internasional atau IMF, dan lain-lain. Ada 5 isu kesehatan global yang dibahas sepanjang pertemuan G20, yaitu pertama, pembuatan dukungan terhadap terbentuknya mekanisme Financial Intermediary Fund. Dana yang terkumpul ini dapat digunakan untuk penelitian, produksi vaksin dan obat, serta perlengkapan kesehatan. Mekanisme pembiayaan baru ini paling efisien, efektif, serta inklusif untuk menghilangkan kesenjangan pembiayaan yang mana setiap negara di dunia dapat mengakses pembiayaan tersebut. Kedua, adanya arahan terhadap struktur mobilisasi sumber daya esensial kesehatan. Ketiga, penguatan surveillance termasuk genomic surveillance, serta memberikan arahan untuk platform kerjasama berbagi data patogen untuk kesiapsiagaan dan penanganan pandemi yang lebih baik. Keempat, penguatan dukungan adanya platform bersama dalam menghubungkan berbagai sistem digital sertifikasi dokumen kesehatan, termasuk vaksin dan hasil diagnostik guna memfasilitasi pergerakan orang dan barang. Hal ini diharapkan dapat mendorong pulihnya situasi ekonomi dan sosial di berbagai sektor. Kelima, memperluas pusat penelitian dan manufaktur global. Perluasan ini diharapkan dapat membuat negara-negara, khususnya negara berpendapatan menengah ke bawah, memiliki akses yang lebih baik terhadap vaksinasi, pengobatan, dan diagnostik. Kerjasama global sangat penting untuk mengatasi pandemi saat ini dan memastikan kita siap menghadapi pandemi selanjutnya. Untuk itu, rangkaian pertemuan dan komitmen yang disepakati menjadi momentum penting bagi G20. Untuk menggalang dukungan dalam rangka meningkatkan kapasitas sistem kesehatan nasional, regional, dan global.
Terbentuknya Pandemic Fund atau dana pandemi menjadi salah satu keberhasilan Indonesia dalam presidensi G20. Menteri Kesehatan Budi Gunadisadikin menjelaskan, untuk mencapai kesepakatan dalam forum G20 perlu 100% konsensus atau persetujuan anggota. Sehingga berbagai upaya dilakukan para menteri untuk mencapai keberhasilan konsensus. Menurut Menkes, pandemi dapat membawa efek negatif bagi perekonomian sehingga dunia harus bersiap menghadapi pandemi selanjutnya. Sementara arsitektur bidang kesehatan global tidak secanggih arsitektur bidang keuangan yang telah memiliki IMF dan World Bank sebagai bantuan dalam menghadapi krisis ekonomi. Dana pandemi ini berperan sebagai katalis untuk menutup kesenjangan pembiayaan dalam penanggulangi pandemi global senilai 10 miliar dolar Amerika Serikat atau 150 triliun rupiah dalam 5 tahun mendatang. Oleh karena itu, Oleh karena itu, dana pandemi dapat menjadi sarana untuk meratakan distribusi pelayanan kesehatan pada masa darurat. Saat ini, sudah ada 20 negara dan 3 filantropi yang berkontribusi mendukung Pandemic Fund dengan total himpunan dana 1,4 miliar dolar atau 21,7 triliun rupiah yang akan disimpan di Trust Fund World Bank. Di antaranya, kontribusi Indonesia sebesar 50 juta dolar Amerika atau 774 triliun rupiah. Dalam gelaran presidensi G20 Indonesia, pemerintah kita telah berhasil mendorong terbentuknya Pandemic Fund. Lalu apa itu Pandemic Fund dan sejauh mana peranan lembaga ini untuk arsitektur kesehatan global? Berikut pernyataan Menteri Kesehatan Republik Indonesia, Budi Gunadi Sadikin.
G20 to make decisions, you need to have 100% consensus. Number two, to make 100% consensus is extremely difficult in these situations. And you know what the fact is? The Pandemic Fund was established. So, thanks to Pak Jokowi, thanks to Ibu Sri Mulyani, we get things done. Despite of a very or extremely difficult geopolitical situation. That is something that I'd like to share. Number two, about the proposal. We have been working. Indonesia is very keen. We would like to prioritize on items that is high on our agenda to prepare for the future of pandemics. Like example, we would like to establish a very strong national public health lab across the country. 34 provinces, 514 cities, a very strong public health lab to do surveillance. So any pathogens, bacteria, virus, or parasite happens or appears, we can identify quickly.
Tak dapat dipungkiri bahwa pandemi COVID-19 bukan hanya telah mengguncang sistem kesehatan global, tetapi juga menjadi pukulan bagi banyak sektor lain. Bagaimana WHO memandang komitmen negara-negara G20 dalam menciptakan sistem kesehatan global yang lebih inklusif, resilient, dan responsif? Kita simak perbincangan kami dengan Senior Advisor dari Direktur Jenderal WHO, Bruce Aylward.
Membangun infrastruktur kesehatan global adalah isu fundamental yang dibahas selama Indonesia pemegang presidensi G20. Dan ini juga menjadi fokus pembahasan antara Indonesia dengan negara-negara G20. Lalu apa saja kerjasama selama 1 tahun terakhir? Kita akan membahasnya dengan Dr. Bruce Aylward, Senior Advisor dari WHO yang ada di Indonesia saat ini. Dr. Bruce Aylward, thank you for making time for us here in this interview.
Thank you.
Okay, welcome to Bali. How's that? How's Bali?
Oh, fantastic. One of the most beautiful places in the world and wonderful people.
And you are here for Indonesia G20 presidency.
That's correct.
G20 Bali Summit. And one of the fundamental themes in G20 presidency is global health infrastructure. How does the World Health Organization perceive about this fundamental issues? So,
well, it's fantastic that the presidency has taken on the issue of the global health infrastructure because as we saw during the COVID pandemic, we have huge weaknesses in the global health architecture. And unless we fix that and fix the infrastructure, the world remains vulnerable. Something like COVID-19 happens and we see that not only is the health system overwhelmed, but society is overwhelmed. The economy fails and stalls. It's extremely important to development, to economic stability and growth that, and of course the health of our peoples, that we have a strong and stable health infrastructure. And the G20 presidency of Indonesia has seen this problem and raised it to a very high level. We can't solve this problem without the G20 because the G20, as you know, 60% of the world's population, 80% of the economic might. It's critical to solving problems like this.
How about the latest cooperation among World Health Organization with G20 countries member in order to ensuring the global health and the global health infrastructure, like you said before in this situation?
Yeah, we've had a fantastic collaboration with the G20 presidency under Indonesia. We've worked very closely with the health ministry under Minister Budi. We've worked very closely and crucially also with the finance ministry under Minister Mulyani. So we've had a close collaboration. We have an office here in Indonesia which works closely with the government. But in addition to that, we've been working from the global level with Indonesia and through Indonesia, all of the G20 countries.
You said that we have the impact because of this current situation, right? And in this, we have been facing unprecedented situation, this pandemic COVID-19. So what was the biggest challenges that the World Health Organization faced in order to ensure this kind of issues?
Well, one of the biggest challenges we face are the gaps in what we call primary health care coverage around the world. Because primary health care is the level at which people get most of 90% of the things that you need to stay healthy, you get at the level of the primary health care. But 2 billion people, actually more, 2.5 billion people, don't have access to the most essential health services. And when that happens, when something like COVID hits the system, it breaks down all over the world. And because we have such an interconnected world, we all suffer. We cannot solve problems like COVID without the whole world working together.
Speaking of the gap, so what is the most important country that you need to focus on in order to reduce the gaps that you said before?
We are missing probably over 15 million healthcare workers around the world. You have to have the workforce. And if you have the workforce, then you give them the vaccines, you make sure they have the training, you make sure they can do the surveillance. But we have to start by making sure we have the healthcare workers. And as you saw in this pandemic, the healthcare workers were very badly hit. They worked extremely hard, they got sick with COVID, they had the mental stress, a lot of burnout, and it just shows the challenge. That is the fundamental. We have to fix that, and then we build the rest of the health system around that.
Okay, and how do we use the World Health Organization to increase the number of health worker in those countries?
So first of all, WHO is on the ground in over 150 countries in the world. So we're physically present to help governments, help partners to move forward on problems like this. And what we also have, because of that network, we were able to look at the countries that have already solved this problem. Many countries have solved the challenge of primary health care or begun to solve it, and the workforce problems. We've seen great progress in places like India and Indonesia and parts of Africa. And what we do as the World Health Organization is look at those best practices, help share those between countries, and then we help countries advocate and apply those messages to be able to strengthen their services.
Yes, of course. And you mentioned India, Indonesia, and also Africa is one of the
different countries in Africa, parts of Africa. Ethiopia has done a good job in this area, and other parts. But we have big gaps in lots of areas in Asia, in Latin America, even in the high-income countries. We saw real problems with access to care.
Okay. What about in Indonesia itself? What will you tell us more about how do we cover the gaps that you face and we face, and everything related to that discussion with the organizations?
Indonesia has been doing a fantastic job. First of all, making sure that they have enough healthcare workers, and then making sure that they have the training and they have the tools they need to be successful, especially in the time of the pandemic. Indonesia has looked very hard. How do we make more vaccines? How do we make more medicines? How do we expand the production capacity? How do we get the private sector involved to help solve these problems? So Indonesia has learned a lot of great lessons that it can help and share with the rest of the world. And that's part of what it's doing through its presidency.
What should we be developed on vaccination?
Well, when a country the size of Indonesia with 300 million people, even more, it recognized that it wants to have a stronger capacity to be able to produce vaccines in the country, produce the medicines that it needs, but also produce the material that it needs to keep healthcare workers safe, the protective equipment. So Indonesia has looked right across. How do we get the private sector to help us? How do we get public sector to help us to develop exactly those tools you need?
So we are talking about how do we get into new normal, right? And how do we talk about the equity of vaccine? So I would like to ask about how equitable of vaccine distribution. You have already mentioned that before. So how is the latest update?
Yeah, we have to be really honest about this. During the COVID pandemic, equitable distribution has been terrible. We have to be honest about that. some parts of the world that were either making vaccines or had a lot of money to buy the vaccines, they got the vaccines first. Only when they had enough vaccines were we able to get vaccines for the poorer countries, that were even more vulnerable, that had even weaker healthcare systems. So in some ways we did well. We were able to solve some of the equity problems and catch up much faster than we did during the HIV pandemic or the last flu pandemic. But the reality was, there was a big gap between when the rich countries got these things
countries
and when the developing countries. And if we look even today, 20% of the population in low-income countries are vaccinated, 80% or 75% in the high-income countries, and that was because they did not have access to the same tools at the same time.
How do you bring those issues in this G20 presidency, and how do we respond from other countries about this one?
Yeah, to solve this problem, we have to do three big things.
Three big things?
Yep. The first, we have to have better governance. We have to have better rules of the game so that we share
better and clear policies
with some accountability. So when something like this happens, we've agreed in advance about equitable rollout. So you have to have the right, what we call governance. The second thing you have to have is strong, let's say, systems to make these products and deliver them. And we didn't have enough manufacturing capacity around the world, and it wasn't well enough, let's say, cooperating, let's say, with equitable access. We have to strengthen those systems. And then the third thing we need is more money. It has to be financed. It costs a lot of money. For this response, we needed over $30 billion. We, at the global level, we received about 20 billion, which was very generous, but it wasn't enough, and it was too late, is part of the problem. So we have to solve those three problems. Better governance and rules. We need a new treaty about pandemics. Then we need stronger systems to produce and make these tools. And then we need better financing. And so here, the G20 under Indonesia has been fantastic. It looked at this problem, it shone a bright light on the problem, and it said, we need a new pandemic fund. And it's created, it's championed this new fund. It will be at the World Bank with WHO helping on the technical side, and it will put more than $1.5 billion in place to help improve the crucial gaps and fix the gaps in the global system.
Has it signed by all the G20 countries, member?
Most of the G20 countries, well, the G20 countries as a group, they have welcomed it, and the majority of G20 countries have already put money into it. We're hoping more will, and that they all will, and eventually many, many more countries around the world, because the pandemic fund is a good start, but we don't have enough money yet to solve this problem.
So tell us more about what would be the strategy to ensuring that they will give and they will have to support the financial things or something?
Well, the first thing one has to do is really demonstrate the case. Why do we need this pandemic fund? And that's what we did this year. Now that we have the fund in place, we have to prove that it works. So we have to get moving very quickly to identify where are the gaps in countries for a pandemic response, and then we have to start fixing them, and we have to demonstrate that there's proof. And at the same time, we have to work with the wealthy countries and others to contribute, because we will need more money to be successful.
Do you think it is demonstrated enough?
No, because it's just started, right? We've just established the fund, and it hasn't even yet started to disperse money. So what we need to do is start getting the applications in, start getting the money out, and start getting the problems fixed.
And then the future pandemic is inevitable, right? How can we reduce that one? How does the World Health Organization perceive about this one?
So WHO this year put out it looked at all the lessons from this pandemic and from previous pandemics. And the Director General issued a paper called 10 Proposals to build a safer world together. And those proposals look at how do we fix the governance? How do we fix the systems, not just for vaccines, but also surveillance and for care? And then how do we fix the financing? The pandemic fund is one part, but we need other things to help if there is a pandemic in future. So it's not a matter of fixing one thing or two things. You have to fix 10 big things in 3 big areas to make this work.
And it should be inclusive on it in order to make that one happen, right?
So the basic principles for any of this work, it's got to be anchored in the right principles. It's got to be equitable, but if you don't have an equitable, inclusive, and sustainable as well system, you're not going to be successful. And those principles have to underpin this new system. And the great thing about this presidency, even before the pandemic was finished, your president stood up, President Widodo, and said, recover together, recover stronger. And recovering stronger means having a better system in place for the future.
Indonesia G20 presidency we will face the G20 Bali summit in this 15 and 16 November. The leaders will talk about the final communique, right? So the next presidency will be held by India in 2020-2023. After all those things that we have discussed here, more about the challenges, the gaps, the three things that you mentioned before. So what would be the next step for the presidency the next year?
That's a really important question, because you can't fix this problem overnight.
Yes.
Pandemics are a multi-year problem. Fixing pandemic gaps is a multi-year problem. So you need multiple years of attention on this. And so Indonesia has worked very closely with Italy, who were the last president, and now they've started working very closely with India, which is the next president of the G20. So we've been working together and agreed over the last 2 days on what the agenda will be for next year. And so with India, we have the Indian delegation here. We've been working out a work plan. So we'll continue the task force that brings the finance and health people together from the ministers from the G20. That will continue next year. It will be made even broader, and it will focus even more deeply on the problems we've been talking about.
So how do we continue the discussion into the next presidency without losing what we have been working on for the last 12 months?
So one of the great things that happened under the Indonesian presidency, under President Widodo and Minister Budi and Minister Mulyani, is they put together a task force of the finance and health ministers from all of the G20 countries. And they've just decided, or they'll decide on the 15-16, to continue that for multiple years, which means the work they've started will now become a multi-year program of work, continuity under the Indian presidency, because we've only just started fixing these problems.
Tell us more about the value message that you want to share to our viewers,
about
the value message that you want to share to our viewers about the ensuring, but what we've talked before, ensuring the health global infrastructure, and then related to efforts.
Yeah, I think what we've learned in this pandemic is the world is incredibly interconnected. For us, it's an interconnected world. We cannot solve problems by ourselves. We have to recover together, recover stronger. And that's where the theme of Indonesia, strength and diversity, is so relevant to the entire world. Because as we come out of this pandemic, what we've learned is we can't just protect ourselves. If we want to protect ourselves and our people, we have to protect people everywhere, because we're too interconnected in our societies, in our travel, in our economies. And under the presidency of the G20 and President Widodo, he's really championed that and raised that. And that's the reason going forward, these Indonesian values of diversity and solidarity is what we're seeing reflected in, despite all the other challenges the G20 faces this year.
And no one left behind.
You can leave no one behind. If you leave anyone behind, we're all going to suffer.
Dr. Bruce, thank you very much for the time talking about this global health infrastructure. Have a good day and enjoy Bali, Indonesia. Berikut wawancara kami dengan Dr. Bruce Airworld, Senior Advisor untuk Organisasi Kesehatan Dunia yang saat ini sedang berada di Bali untuk G20 Bali Summit, serta pembahasannya tentang bagaimana isu kesehatan di presidensi mendatang, yaitu di India 2023 mendatang. Terima kasih, sampai jumpa.
Dari penjelasan penasihat senior untuk Direktur Jenderal WHO tadi, kita patut berbangga karena Indonesia telah berhasil menyiapkan berbagai skenario untuk menghadapi pandemi. Ada 10 proposal yang diusulkan Indonesia untuk mengatasi masalah kesehatan, khususnya pandemi di masa depan. Indonesia juga berhasil meluncurkan Pandemic Fund untuk pembiayaan penelitian dan memperbaiki infrastruktur kesehatan global. Sehingga bila terjadi pandemi di masa yang akan datang, negara anggota G20 sudah siap untuk mengatasi. Menteri Keuangan Indonesia Sri Mulyani Indrawati mengungkapkan ada tambahan 3 negara G20 yang telah menyatakan komitmennya untuk menyuntikkan dana ke dalam Pandemic Fund. Negara-negara tersebut adalah Australia, Perancis, dan Arab Saudi. Komitmen masing-masing negara akan diumumkan pada KTT G20 15 hingga 16 November mendatang. Sebelumnya, sudah ada 20 negara donor yang berkomitmen dalam Pandemic Fund, diantaranya India, Kanada, Indonesia, Italia, Jepang, Tiongkok, dan Amerika Serikat. Serta 3 filantropi yaitu The Bill and Melinda Gates Foundations, The Rockefeller Foundations, dan Wellcome Trust. Dana yang terkumpul pun telah mencapai 1,4 miliar dolar Amerika Serikat atau 21,7 triliun. Data terakhir Pandemic Fund membutuhkan 31,3 miliar dolar Amerika atau 469,5 triliun per tahun. Dan saat ini baru terkumpul 20,6 miliar dolar atau 309 triliun rupiah. Artinya masih ada gap 10 miliar dolar atau 150 triliun. Presidensi G20 juga meyakini jumlahnya akan bertambah sepanjang KTT G20 berlangsung, di mana nantinya dana akan disimpan oleh trustee, dalam hal ini Bank Dunia.
Identifying that the world require or need approximately 10 billion pandemic preparedness and response financing gap. So the first initial establishment of this pandemic fund, which is currently we are receiving now 20 contributors, both the G20 members country as well as non-G20 members country, as well as also some philanthropies, 3 philanthropies at least identified. They are all contributing now up to 1.4 billion. In fact, tonight we also receive at least 3 countries expressing that they are going to also contribute, including Australia, and then France and Saudi. They are going to announce the amount, especially during the leaders' meeting. So this is going to be expected larger than 1.4 billion. With that kind of pandemic fund, which is already established, we are now focusing on how we are going to improve the international health architecture. Still continue the role of WHO as a technical lead, as well as chairing the technical advisory panel, and the World Bank as the in this case as a trustee for the pandemic fund. We've already also appointed the chairperson, in this case, a joint between Indonesia and Rwanda, that is Pak Khatib Basri, as well as Minister Hamjin, which is going to chair this fund. And we will then starting to ask for the proposal of the use of this fund. All members of the G20 requesting that the governance of this fund should be inclusive and especially also paying more attention for the low-income country and developing country in terms of building their capacity for the pandemic preparedness.
Selain masalah kesehatan, dunia saat ini juga menghadapi krisis pangan di beberapa wilayah. Badan Pangan dan Pertanian Dunia atau Food and Agriculture Organizations (FAO) menilai peran Indonesia sebagai ketua G20 dapat dimanfaatkan untuk mengajak negara-negara anggota G20 mengatasi masalah kerawanan pangan serta kelaparan yang terus meningkat di dunia. Persoalan pangan ini penting sebagai penunjang program dalam menciptakan sistem kesehatan global. Kita simak wawancara dengan Maximo Torero, Chief Economist FAO.
Pertumbuhan penduduk dunia yang tidak sebanding dengan produksi pangan dan terganggunya pasokan pangan akibat perubahan iklim dan juga perang antara Ukraina dengan Rusia menjadi sejumlah faktor yang menyebabkan terjadinya krisis pangan secara global. Organisasi Pangan dan Pertanian PBB FAO kini kian gencar mengajak sejumlah negara untuk bekerja sama mengatasi dampak dari krisis pangan dunia ini. Lantas apa saja fokus dari FAO untuk mengurangi dampak dari krisis pangan secara global? Saya akan membahasnya dengan Chief Economist dari FAO, Maximo Torero. Good afternoon, Mr. Maximo.
Hi, how are you? Nice to meet you.
Nice to meet you too. I'm great. How Bali?
Oh,
Do you enjoy our beautiful island?
It's a beautiful island, a beautiful country.
So I'm gonna hit straight to the first question.
What do you think the world situation right now regarding of the world insecurity crisis?
So the world right now is facing a big challenge. This year we have what we call a food access problem, and the reason why it's a food access problem is because food prices has been going up a lot. So the highest historical was in March, then it has declined a little bit, but it's still very high. And means that people which don't have too much resources won't be able to buy food, and that's why we call it food access. This was created by a situation that was after COVID-19, where prices were already going up, but it was exacerbated by the war in Ukraine. And the reason of why it was exacerbated was because Russia Federation and Ukraine export 30% of the cereals in the world, and they are also a key exporter, Russian Federation, of fertilizers. Now, why it was going up before COVID-19? Mostly because of conflict, because of slowdowns and downturns, that's where COVID-19 hit, but also because of climate change. So this year, food access problem. Next year, the major challenge we have is food availability.
Which country that you think at the big risk of this insecurity of food?
So, look, initially, of course, the countries which are the most affected are the food crisis countries, and we have around 43 food crisis countries, but this number keeps increasing, and most of them are based in sub-Saharan Africa, especially landlocked countries and countries in conflict, and there are also some countries in South Asia. But because of the war in Ukraine, initially the countries that were really affected were countries that were net food importers and which import more than 60% of their cereals from these two countries. But if you ask me which are the countries suffering the most, are the food crisis countries, because these are countries which have a situation of acute food insecurity, which we classify as IPC 3 or above. And some of them, like Somalia, are entering into a process of famine, which is when you start dying because of lack of food. So those are the countries we have to work. Now, in addition to that, a group of countries, 62 countries, which most of them are low income or low middle income countries, are facing significant challenge of balance of payments because they have to pay, they are net food importers, they already have too much debt, and they have to pay higher prices for food, and also they have a problem of exchange rate devaluation, which means that their import bill has increased. And these 62 countries represent an increase in the import bill for them of around $25 billion. And this is affecting 1.72 billion people. So that's what we are trying to support those countries so that they don't go into a crisis because it could create social unrest. And that's where we have proposed the Food Import Financing Facility, which now the IMF is picking up and is going to help to support a subgroup of these countries.
Do you think our country will be one of the countries that will facing the same risk in the future?
Your country has progressed enormously in terms of rice production and rice capacity. Right now, you produce what you need and you even export, and you are willing to help other neighbor countries. So I hope if you continue with the correct policies, you will be able to resist and to be resilient to the existing shock. But for sure, as many other countries, Indonesia will be affected because of the increasing prices of fertilizers and input prices. And that's where I think a lot of work needs to be done so that fertilizers can flow, especially for the rice production, because the last thing you want is that the affordability continues to go down for the farmers and that they will plant less for next season. So the expectation is that if you continue doing the correct policies and supporting the agricultural sector, you will be able to cope better. But all the countries will be affected because of the increasing prices.
So what is the role of FAO in the middle of the treatment of the food crisis right now?
So the role of FAO is a specialized agency, is the Agriculture and Food and Agriculture Specialized Agency of the United Nations. Our role is to be able to help to countries, member countries, to achieve SDG 2, SDG 1 and SDG 10. No? It's zero hunger, reduction of poverty, and reduction of inequality. And of course, in a sustainable agri-food system that affects climate change and so on. So in this situation of crisis, our job is to provide governments support in terms of how to assess the situation and what policies can be put in place. And there are policies of the very short term. Those are mostly emergency policies to help countries in emergency situations by allowing them to continue producing, because that's a lot more cost effective than just transferring cash transfers for food. The second is to provide them ways in which they can increase their resilience. And to increase resilience means three things. One is to have early warning systems, like the situation room that you have here, the war room, that will allow countries to be better prepared for a shock. The second one is to increase your capacity of absorption of a shock. So if you have a shock like the war or a shock like COVID-19, how much capacity your country will have to be resilient to that shock. And that implies having diversification of where you buy your food. If you are an importer, it implies improving your value chain so that you can supply more, like what you are doing in terms of rice here. So it implies all these innovations. And the third element of resilience is how we can build back better if we have a shock. And for that, you need to reduce inequalities. You need to invest a lot in infrastructure, especially in value chain infrastructure. And that's where FAO is working. FAO has a flagship program called the Hand in Hand Initiative, for example. We are working right now with 53 countries where we are exactly helping them to develop and to accelerate areas of growth in agriculture, to reduce poverty, to reduce inequalities, and to move them out of hunger.
So what is the benefit or what is the use of the forum of G20 right now in coping the insecurity of food prices?
No, the G20 is extremely important because the G20 brings together the most developed countries, of course the 20 most developed countries, and it can help to create consensus to do the steps that are needed. And what is priority right now? Transparency of information. For example, the G20 of Paris created the Agricultural Market Information System, the AMIS. This G20 is supporting the AMIS substantially. That's really important because it has helped to bring more information of what production is there, what stocks we have to the world, and that helps to reduce problems and to reduce volatility. It also creates initiatives to assure sustainability of economic growth. Especially, it's very important to keep trade open and to keep the flow of food open, and the G20 has been pursuing that. The Agricultural Ministerial is very strong on the importance of keep trade flow. Also important in issues of food safety and in issues of how to increase sustainability and how to cope at the same time with climate change.
Okay, this is going to be the last question. What will be the first focus or the most important focus from the FAO to coping all the crises? Which country need to be safe first?
No, the role of FAO is with all the member countries. It's not with one country. We help all the countries at the same time. And this goes from low middle income to high middle income countries. We also work with developed countries. The important thing here is that we need to understand that the world is interlinked. And what happens to Indonesia will affect other countries, neighbor countries and countries in other parts of the world. What happens to the US will affect poor countries and rich countries too. What happens in Russia will affect what happens in Ukraine will affect. So these interlinkages are really important. So the job of FAO is to move towards an agri-food system transformation that assures that we have better production, better nutrition, better environment, and better life. That's what we are looking for. And that requires investment in agriculture, but requires investment that is sustainable. Because I can produce more, I can increase productivity, but I need to do it in such a way that the quality of the food that people are available will improve their nutrition, and that they will also affect the environment too much. So we have to be environmental sustainable. And that is what will give you the better life that you want.
Okay, thank you so much for this discussion. Chief Economist FAO, Maximo Torero.
A pleasure.
Hope you have a very good time in Bali right now.
Thank you so much. Thank you.
Dan itulah diskusi saya dengan Chief Economist dari FAO, Maximo Torero. Terima kasih banyak dan sampai jumpa.
Demikian FMB 9 hari ini, semoga dialog ini bisa memberikan informasi dan menambah pengetahuan serta wawasan kita. FMB 9, informasi akurat, data valid, narasumber terpercaya. Dari Bali International Convention Center, saya Ruli Kurniawan. Terima kasih dan sampai jumpa.